so happy we alive.
Good evening and welcome to Louisville Late Night. I'm Patrick Moore, and this evening we're in gorgeous San Francisco, California, where we're sitting in on the National Normal Conference. And this evening we're privileged to have with us a scholar and clinician, Dr. Ethan Russo from Missoula, Montana. Dr. Russo is a neurologist, physician, medical doctor, and he is the founder and editor of a very informative medical publication, the Journal of Cannabis Therapeutics. And with no further ado, I want to introduce you to Dr. Russo and ask Dr. Russo, Ethan, do you mind if I just say Ethan?
That's great.
If I asked Ethan how he came to found this journal and how it might be relevant to us in the Louisville area. Dr. Russo, Ethan.
Well, thanks for having me on, Patrick. I welcome this opportunity. Back in 1998, I was lucky enough to finally meet Lester Grinspoon, and I remember shortly after meeting him, he said to me, you know, what we really need is a new journal, a Journal of Cannabis Therapeutics, perhaps. And that certainly resonated with me. I got the idea that he thought it was a good idea, but perhaps didn't feel like he wanted to do it himself at that point. But I had a relationship with a publisher, Haworth Press, and we subsequently, within a few weeks actually, got the idea to gel and be accepted by the publisher. As these things happen, it takes some time to get things off the ground, and we actually first published in 2001.
Really?
Right.
You know, I had been thinking myself, I mean, there's marijuana, the forbidden medicine, Dr. Grinspoon's landmark publication, and then there's marijuana myths, marijuana facts by Dr. John Morgan and Lynn Zimmer. But there's just and there is some literature out there available about medicinal marijuana, but before the Journal of Cannabis Therapeutics, I had never heard of any such thing. And when I first saw it, I don't know what meeting it was at. I guess it was just within the last 2 or 3 years. I thought, wow, what a great idea, because all of this confusion, all of this heartache, all of this gut wrenching from the government teaching that marijuana is equal to heroin and is terribly addictive and can destroy your life, and from that extreme to Lester's position that marijuana is a miraculous miraculous drug, a healing drug. It has made for a tremendous amount of confusion.
Right.
And so I personally was thrilled to hear of the publication of the journal. And
well, you know, that was exactly the idea that we wanted to get across. First of all, there is this gap. We have some excellent books you cited that are available to the public, but heretofore there hasn't been a publication for physicians or scientists in one place that would collect this information. Plus, I also saw a real information gap. This cannabis as medicine has a tremendously long and rich history that most physicians let alone the public, are not aware of. Just as a brief example, let me point out that between 1842 and 1942, both in Europe and in the United States, cannabis was a mainstream medicine that was used for a lot of different conditions, for painful conditions, migraine, spasms. It was used as an aid to childbirth. It was used to treat morning sickness. It had a great deal of use in women's diseases, including things like menstrual cramps. Queen Victoria used cannabis monthly throughout her adult life. This is well documented, and it's just the kind of thing which people aren't aware.
I mean, internationally, there's a long history of use of cannabis.
There sure is, and additionally it extends down to folk medicine, or what we prefer to call ethnopharmacology. That's a way of saying what indigenous people have used to treat their disorders. So if we look at cultures like throughout the Middle East, the Arabic cultures, tribal people in Africa, India is a great example. India and now Pakistan, thousands of years of use of cannabis as medicine. It goes back to one of the holy books of Hinduism, the Atharva Veda, 1500 BC, where they describe the use of cannabis as an agent to treat grief. Certainly there's a Chinese tradition allegedly going back to 3000 BC. But we've got documentation that this was a common food, the hemp seeds, in ancient China, and even today there are parts of China where village people use cannabis to treat a variety of conditions.
Well, with all of this history of cannabis, I mean the therapeutic or positive use of cannabis by cultures, why is it that so many countries, not just the United States, cannabis is illegal? Of course, I know there are some changes going on, but well,
I'm afraid this is based on a lot of misconceptions, and it really comes down to an issue that's a serious one around the world, which is legislators make law and doctors don't get to make the decisions. I'm also very interested in herbal medicine in general, and I can tell you that in our country in particular, that's an ignored aspect of medicine. There's some valuable things.
Herbal medicine,
right?
Like Andrew Weil type of.
Right. A lot of that herbal medicine has a scientific basis, just as cannabis does. I feel strongly that where safe, medicine should be a decision made by patients with their physicians. And it certainly is the case that politicians are less equipped to make these kinds of decisions, and yet they have the power to do so. I think that that's wrong and needs to be changed.
Are you finding? I don't know what the status of the laws are in Montana, and in fact, from the perspective of this program, I'm really much more interested in simply the education aspect of what the truth is here, as opposed to the complexities of the war on drugs and so forth. I think that people have a right to know the truth.
Right.
And
well, simply put, cannabis is a very powerful and dynamic medicine that offers a great deal of relief to people with a number of conditions where we do not have good drugs now. And that's the thing we're trying to do in the journal, is demonstrate not only the history, but the range of indications, number of conditions where cannabis can be helpful, and demonstrating their scientific basis. My mission, if you would be, with this journal, to provide a forum in which